I was asked to talk about nutrition and breast health and a little bit about me. I'm actually here in Austin, Texas. I have my PhD in nutrition. I'm a registered and licensed dietitian. I practice at an outpatient clinic at the Livestrong Cancer Institutes at UT Austin, and I also have my own private practice as well. So I've been an oncology dietitian for several years now, but also my PhD work was in diet and cancer. So this is a field that I've been in for a while. And as Amy talked about a little bit, that there's a lot of misinformation related to nutrition and cancer. So what I wanted to do today was just broadly talk about our dietary recommendations of plant-based eating and what the benefits of that are, some tips that can help with some more healthful eating, and then wanted to talk about a couple of common myths that I hear, especially in relation to breast cancer. And how I talk about diet and cancer is that your diet did not cause your cancer. I often hear a lot of shame and guilt because we talk about cancer prevention, but recognizing that the term cancer prevention means reducing the risk of developing cancer, right? Because cancer is essentially a normal healthy cell that had a genetic change because of DNA damage. And so that DNA got damaged. These control mechanisms that we have to keep cells from replicating got messed up. And so then these cells just keep replicating. So how does diet have an impact on this? Well, we know that a healthful diet can limit exposure to known carcinogens. It helps promote the activity of natural detox systems. So our liver is really good at detoxifying chemicals so that they can be excreted from the body. We know about relationships between reducing DNA damage so that anti-inflammatory compounds in foods can protect that DNA from getting damaged, and then also can support immune system. So our immune system is also constantly on surveillance looking for when cells are going rogue and will try to attack and kill those cells. So supporting the immune system can help with that surveillance piece and keeping healthy cells in check. And we're learning a lot more about this now too with immunotherapy and how nutrition can help support that as well. And if you're not familiar with this organization, I highly recommend it. It's the American Institute for Cancer Research. They're a nonprofit organization that is based on evaluating the scientific research on lifestyle factors in cancer. Every 10 years, they come up with a report. And interestingly, over the past 20 years, the research keeps showing the same thing, and that they have these cancer prevention recommendations, which include eating a healthful diet that's rich in whole grains, vegetables, fruits, and beans, maintaining a healthy weight, limiting consumption of red and processed meats and processed foods, limiting alcohol. As Amy talked about, being physically active is in those guidelines as well. So I'm going to talk about one of these, the diet rich in whole grains, vegetables, fruits, and beans, but recognizing that the literature and the research has continued to support the benefits of a healthful diet and being physically active. So Amy touched on that and the importance of that. And then key themes, these keep showing up in just overall disease prevention, not just reducing the risk of cancer recurrence, but cardiovascular disease, diabetes, cognitive health, that we know that these two lifestyle factors have significant impacts on disease risk and overall health. So in one of those cancer prevention guidelines was eating a diet rich in whole grains, vegetables, fruits, and beans. And we can call this a plant-based or a plant-forward diet. I like to emphasize here that this does not mean no meat. When we talk about plant-based, plant-focused, just meaning that your plate is primarily plant foods, but you can still include animal products. And this becomes especially important when animal products are a good source of protein to help with that building and recovery. But you can also get most of your nutrients from plants. And so a plant-based diet is limiting meats, specifically more of the red meats, limiting dairy products, eggs, or highly refined foods like white flour, refined sugars, and added oils. Okay, but what I like about this picture is looking at all these colors in our plant foods, because that gives us a little insight into just the array of health benefits that come from plant foods. So a plant-forward diet, plant foods contain antioxidants, for example, vitamin C, vitamin E. And what these do is that when there is inflammation in the body, it will help reduce that inflammation so that there can be less damage or potential damage to DNA. Also have overall anti-inflammatory functions, and then promoting the activity of natural detox systems. So when I talk about this, is there's a lot of marketing around reducing inflammation, supporting immune function, detox cleanses and teas, and all of these things being promoted from pills and supplements, when these are natural things that are in plants, that you don't have to buy a detox, you don't have to go on a cleanse, that eating plant foods exposes your body to these natural anti-inflammatory detox promoting foods. Because plant foods have something called phytochemicals. So phyto meaning plant, chemicals meaning the compounds. And they've identified, researchers have identified thousands of active compounds in plants that provide benefits. So they're not necessarily essential nutrients. They're not like our vitamin E and our calcium, but we don't need them to survive, but we're learning more about how these compounds have additional health benefits in us when we consume them, including supporting the immune system, reducing inflammation, preventing DNA damage, helping with repair of DNA damage. Some have even shown anti-cancer properties, so actually slowing the growth rate of cancer cells, regulating hormone levels as well. So on the left is a picture of some examples of some plant foods. For example, lycopene is something that gives tomatoes this red color. Lycopene is also found in watermelon, pomegranate, and that's something that's providing a color in these plants has actually been shown to have anti-cancer activity in animal models and in human trials as well. So this is just showing that these compounds and this array of colors is actually a sign of some of the variety of health promoting compounds in these foods. Okay. So the more color, the better. For example, what is in this purple cabbage is different than what is going to be found in watermelon and different than what you're going to find in broccoli. I like what Amy said about the best activity to do is the one that you enjoy and are going to do consistently. So the way I talk about the fruits and vegetables, we're like, oh, what are the best ones? Which ones should I eat? The ones that you can afford, have access to, include in your diet regularly. So the more variety, the better. Just because you don't like broccoli doesn't mean you're not going to have good health. There are cauliflower, bok choy are also in the same family of vegetables. So the more variety you can expose your body to, the better. And another benefit of health of these plant-based diets is that it can support intestinal health and regularity. We are learning more about the role of our microbiome, those bacteria in our intestine, and how they support immune function, how they can help lower inflammation in the body, and just have overall health benefits. So we're just like scratching the surface, I think, of the whole microbiome world. It's really quite fascinating about learning about all of these different bacteria and what they can do for our health. And then also knowing that our intestinal transit is another way of detoxing. We have a natural detox system where things that our body does not need gets eliminated through the stool. Having regular bowel movements is a way to help with overall health as well. So dietary fiber is going to be found in plant foods. This is the only way that you're going to get fiber is through plant foods. So fiber is these carbohydrates that plants have that provide the structure for these plants, but we can't digest them. So we can't use it for energy, but it still has health benefits in us. So one way is soluble fiber is a type of fiber that is soluble in water. So it kind of forms a gel. And in that gel, it can help slow digestion. It can also help trap some cholesterol, so helps with lowering cholesterol. And then that soluble fiber is a type of fiber that our bacteria like to eat. So you might have heard of probiotics. That's the name for bacteria. Prebiotics is the type of food that the probiotics eat. And that's what soluble fiber is. It's a prebiotic. It helps feed those bacteria. I tell people that you kind of got to think of them like your fish, your little fish. You got to feed them daily. There's a little sprinkle of fiber. So a lot of people spend money on these probiotic supplements, spending a lot of money on that. And like all you're doing is putting more fish in the tank. You got to feed those fish and have a good variety of those fish. So that's what soluble fiber does. Insoluble fiber is not soluble in water, hence the name. But the way that it works is it actually helps with bulking bowel movements. It also has a little bit of a cleansing role in that it kind of triggers the intestine. It's rough, it's roughage. So it's irritating to the intestine in a way that it promotes motility and helps the gut move and eliminate bowel movement. So insoluble fiber is helpful for those that are suffering from constipation. And I say the term suffering because I know it can be pretty bad and that cancer treatments can really have a long-term impact on intestinal health. And so it is important to be intentional about including these plant foods to help feed those good bacteria, help promote regular bowel movements. Like, okay, that's all well and great. I've heard that I need to eat plants. I don't think that's news for anybody that a plant-based diet is helpful, but how do you make it happen when you might still be struggling with cancer fatigue, want things that are affordable because you're still paying your treatment bills? How can we utilize some strategies for healthful eating? To keep it simple is my main takeaway point when working with people. Follow a basic formula. Just think about what you want your plate to look like. This is also from the American Institute of Cancer Research, that having a third of it for or less of animal protein. So if you are still eating animal products, thinking about a third of your plate, and then filling the rest of it with the plants, with the vegetables, the fruits, the whole grains, the beans, and trying to set your plate up like that most of that plate is plants. And start somewhere. Some people want to eat a more healthful diet after cancer, and that can feel like a big overhaul. Maybe during treatment, you're just eating whatever you could and whatever tasted good and whatever you had time to eat. And now you're trying to get back on track with a more healthful diet. It can be a lot to change overnight. And I never recommend making dietary changes overnight, but start somewhere. Maybe that's one new recipe a week. Maybe you're going to bring home one new vegetable for the family to try this week. So instead of filling your whole cart with all these vegetables and fruits and beans, like we're going to eat healthy this week, and then don't know what to do with all of these foods. Your kids don't like the broccoli, like forget it, right? So meeting yourself where you're at and starting slow. And then avoid the comparison trap. I think on social media and Pinterest, there's all these beautiful pictures of food. And those could be good inspiration or make you excited to eat something, but it can also make people feel like meals have to be complicated. And it doesn't have to be pretty. It doesn't have to be expensive superfoods. It just has to be edible. It just has to be something that you and your family enjoy. And remembering that your health is worth it. I know that these types of meals might take a little extra time, a little extra planning, but recognizing how important these plant-based diets can help in improving overall health, also known to help improve fatigue and support overall quality of life. And then another way to keep it simple is if you have limited time or cooking skills, just add veggies to what you know how to do. The family likes pasta. Could you throw in some spinach or mushrooms? Casseroles are a great way to hide vegetables. Omelets can be some sauteed veggies in there. If you're having a frozen pizza night, throwing in some more peppers or mushrooms or onions, just finding ways to sneak in more plants, kind of meet yourself where you're at. It doesn't have to be complicated. Some other examples for ways to get some more plants in your diet, maybe aiming to have a meatless meal a few times a week or once a week, like a meatless Monday is a trend. There are also many plant-based alternatives out there for those that are experimenting with reducing their animal protein intake. You can drink them if you want to make a smoothie in the morning. That can be an easy way to throw in some veggies. And just as I gave an example, just adding veggies to what you know how to do. A sandwich, a pasta, a wrap, meet yourself where you're at. And then if you do need some inspiration, Pinterest or a foodie Instagram account could be a way to get some ideas about what to do with different vegetables. And rethinking like the idea of fast food. Yes, we are very much on the go or have limited time to cook, prepare meals, but think about that these are also some options that are a rinse away or just open the package and you've got a high protein snack here. You've got some fruit, veggies, that those can be some convenient ones to have on hand. So I want to briefly talk about some myths that I hear often in relation to breast cancer. A big one is to avoid soy and soy products. Where did this come from? Well, soy has a compound called isoflavones. And so this is the structure here on the right. And you can see it's a very similar structure to estrogen. So in animal studies, literally decades ago, they found that when they gave high amounts of these isoflavones, these isolated compounds, that it did promote the growth of estrogen receptor positive tumors in animals. But to recognize that that information got overblown into saying that all soy is bad, and that getting a very isolated and high concentration of a compound in a food is very different than eating the food. That the doses that they use in those types of studies were not anywhere near what someone could get from food. And that recent research has shown even a protective effect of soy consumption in relation to breast cancer. So they've seen either no effect or protective effects of soy consumption in breast cancer. So this is a really big fear. And the reason why I talk about it is I've often seen that people are just scouring labels and afraid of seeing any mention of soy on the label. We're knowing that moderate amounts of soy foods may actually help lower the risk for breast cancer and recurrence. And moderate means 1 to 2 servings a day. And we're talking about whole foods. So things like tofu or soy milk or tempeh, edamame, not soy protein. So I recommend to avoid soy isoflavone supplements. Those are typically found in things that are promoted as like estrogen support or something marketed to help reduce hot flashes. They typically are using concentrated extracts of isoflavones. Also, there are little to zero isoflavones in soybean oil, soy sauce, or soy lecithin. So if you see that on a label, there are no isoflavones in there. And just an example of the amount of isoflavones that you would get from food. Right? So very little with soy milk, tofu, edamame, versus a concentrated soy protein compound. Okay, so I know some people, this is still like a myth that just won't go away. And the research has been pretty consistent that there is not an association between soy consumption and risk of recurrence. In fact, we're seeing the opposite, actually benefits of soy. Okay. And then there's this other myth that you need to eliminate all animal products. Right now, there's no clear evidence that a vegetarian or vegan diet is more protective than a plant-based diet that still includes lower fat meat and dairy products. The American Institute for Cancer Research, one of the cancer prevention guidelines is to limit red meat. That guideline is based on its association with colon cancer. And that limit is 12 to 18 ounces per week. think about a quarter pounder, a burger, that is 4 ounces. So thinking about having 4 of those a week would be the limit on red meat. Also, the recommendation is to avoid consuming any processed meat. So that includes bacon, hot dogs, deli meats, because of the nitrites, and their association with colorectal cancer. So it doesn't mean none. Even within these guidelines, they recommend just limiting the red meat to less than 18 ounces per week. And then often another trend that I'm seeing a lot is this promotion of these exotic and expensive superfoods, again, making nutrition seem very out of reach for people, healthful nutrition. There are no miracle foods or supplements that you must include in your diet. And when you see these types of things, like these foods are going to kill cancer or natural cancer cures, these are often extrapolated from animal or cell studies, where they took a compound in a food, gave a very high dose, and saw some type of health benefit. We are not mice. We also know that each cancer type is different, and that in those studies, they can control everything. You've got mice in a cage. You can control how much they consume, how long they're getting it, which is not factoring in any of the other influencing factors we have on our health. So just because something got a headline and a lot of attention does not mean that actually plays out into humans and any benefit that we'll see in humans. There's a lot of marketing about these types of special supplements or special diets that you must follow. And when people are making this decision about what diet they want to consume, does this diet that you're looking at consider your nutritional needs or the effects of cancer treatment? For example, many breast cancer survivors are at a higher risk of heart disease because of the effects of some of these chemotherapeutic agents on heart health. So should you really be consuming a diet that is high in saturated fat and that could actually increase your risk of developing atherosclerosis and heart disease? Or if you're excluding large food groups, like if you're removing carbs from your diet, that's also reducing your intake of fiber and all the benefits I talked about, fiber and all of those phytochemicals. So also thinking like just because a diet is popular, it does not mean that this is actually good for your health. And actually some of these popular diets may be going against these cancer prevention guidelines that are based on decades of research in humans. So again, what I see a lot in working in the cancer nutrition area is there's a lot of misinformation. And just because it's talked about in a support group you're in on Facebook or someone next to you in treatment told you about it, it's important to critically evaluate nutrition information, maintain a healthy skepticism. If it sounds too good to be true, it likely is. Trying to read beyond the headlines, that nutrition is a really trendy topic, a lot of attention, but they're just trying to put out articles and put out posts and not necessarily getting into the nuance of that research finding. And also consider the source about who you're getting that information from. Are they really a reliable source of that information? Because big thing I see is fear mongering makes monies. If they can sell you a problem and convince you that it's one food or one diet that's harming your health or what caused your cancer, they can sell you the problem so then you can buy their solutions, right? Their books, their supplements, their websites and subscriptions, seminars, endorsement deals, that people are making a lot of money by inducing fear about food and diet. So it's a hard field to work in some days, but nutrition, I love studying nutrition. I recognize the importance of it, and it's an important tool in your health, but recognize it's not the only health tool. We talked about physical activity being important, but also stress management, hydration, adequate sleep, adhering to your medications, access to healthcare and your regular follow-ups. These are also important pieces of overall health. So briefly, just want to talk about putting these recommendations into action, because again, this might have been information you've already heard about the benefits of a plant-based diet as well. And after cancer treatment can feel like there's a lot that you need to do. It's like, I've got to get back to work, and now I want to be more involved with my kids and my family, traveling. It's like, you don't have to overhaul your whole lifestyle right away. It's like, identify your priorities. What's most important for you right now? Did you lose a lot of muscle during treatment and you want to gain that back? Then maybe prioritizing getting connected with a physical therapist and focusing on more protein in your diet, for example. Or if you're still having a lot of GI side effects, maybe that's a priority right now and you want to have more regular bowel movements, normalizing that. So identifying what your priority is, so then you can develop a more focused strategy about how to address that. So I gave that example of muscle and strength gain. I'll ask my doctor for a referral. I will add high protein foods to my breakfast. If you want to normalize bowel movements, your goals could be about having a serving of fruit with lunch or drinking some more water with your meals and snacks. And one thing I really like to get across is to abandon the all or nothing mentality, as she talked about with exercise too, is like, okay, so you can't go out for an hour walk, but can you go for 10 minutes? Right? So you can't meal prep all of your meals for the week. Can you make sure you've got breakfast ready to go in the morning? So abandon that all or nothing mentality, setting realistic goals, doing what you can. Don't compare where you're at in your survivorship to anybody else. Everyone's experience is different and circumstances are different, but any progress is good progress. And again, with an oncology dietitian, if you need some more focused help when it comes to your diet, recommend reaching out to a dietitian. A dietitian is different than a nutritionist. We have 4-year degrees from accredited programs, supervised internships that are 1,200 hours, take a credentialing exam, and then have to maintain our continuing education requirements. So this is different than anyone who can just say, I'm a nutritionist, I'm a health coach, that these are things that aren't really regulated, but the term dietitian is a regulated term, and you know that they are someone who has had specific training in nutrition. So in summary, lifestyle factors reduce the risk of recurrence. So broadly limiting alcohol, added sugar, red meat, processed meat, while increasing the consumption of plant foods. Remember that simple changes can support your overall health. Don't overcomplicate it. Keep it simple. And if you need some additional resources, highly recommend the American Institute for Cancer Research. The National Cancer Institute, American Cancer Society have some good tools too in relation to diet, but AICR is my favorite. It really is more consumer friendly, focused, good recipes, exercise tools, all free as well. But if you'd like to follow me on social media, I have an Instagram page, Cancer Nutrition HQ, and you can also reach out to me, Dr. Z at drznutrition.com. Now I'll go ahead and stop the share, and we can open things up for questions. It looks like there's a couple in the box. Okay, what's the issue with eggs lately? Yeah, so in our most recent dietary guidelines, they actually removed the restriction on cholesterol because they found that dietary cholesterol does not necessarily correlate with blood cholesterol levels. So there's no limits on dietary cholesterol, and that's where a lot of the fear around including eggs was. But we're also learning about, that eggs have in that yolk, this was a yolk that's meant to like make a baby chick live. So it is really nutrient dense and has a lot of healthy fats in there, antioxidants in there. That yellow and orange color of the yolk is actually lutein, which is a carotenoid known to be good for cognitive health and eye health. So yes, it can be a really good source of micronutrients. The eggs can be, as well as protein. Also, yes, the nightshades thing is another myth. There's no research on these nightshades being something that increases inflammation. But I tell people, just because there's not research about it, but if you find that when you eat a certain food and it does not make you feel good, then you don't need to wait on a research study for that. You don't need to include that in your diet. I give my example of like quinoa. Yes, lots of great health benefits of quinoa, but it tears up my stomach anytime I eat it. Just have a lot of abdominal cramping. So it's like, okay, not for me. I don't know why it's happening, but it's not for me. So the nightshade thing is a myth, but if you do find that when you eat it, you feel more inflammation, pain, then you can exclude them. If I recommend soft tofu only, not firm. No, any tofu is a good source. It's the texture of the tofu will be different, but nutrient-wise similar. The cancer organizations that I reference as resource strictly follow the USDA MyPlate Nutrition Plan. So the American Institute for Cancer Research is basing its recommendations based on their evaluation of the research for cancer prevention. So it actually it's not the same thing as the dietary guidelines for Americans from the USDA. So the American Institute for Cancer Research is not the same thing as the dietary guidelines.
I have a question for you.
Yeah.
What is your recommendation about intermittent fasting or mimicking fasting before treatment? I haven't started treatment yet, but I've had somebody suggest the mimicking like 3 days before my treatment to do a limited calorie intake of 100 or 500 to 800 calories a day to help regenerate those new cells. Like, what are your thoughts about that?
Yeah, so there's some emerging research in some of these metabolic therapies in combination with treatments. And in particular, the fasting mimicking diet has had one clinical trial in breast cancer. They have not found there to be any significant benefits based on their research. They just came out with another study. And what they really talked about was it's important for the individual to recognize if this is worse. Well, a lot of factors need to be considered. If you're taking medications that need to be taken with food, you need to factor that in. And if there's unintentional weight loss, then you should not be doing the fasting mimicking diet. I will say there is some intriguing research. It's not something that I feel strongly enough to be recommending to people because I think there still is a lot to learn about who it's going to benefit and how much of a benefit it might have. But I would say what the research that is out, it's been primarily in breast cancer.
Thank you.
Any other questions about nutrition or exercise?
I have one more. I'm sorry.
Yeah.
This one's more for Amy. I'm a marathon runner, and like I said, I was just diagnosed, so I'm going in for my surgery on March 2nd, and then I'll start my treatment a month later. Exercise is extremely important to me. It's my mental sanity. So I'm curious as to how, I know it depends on how I'm going to feel and how I'm going to react to my treatment. But like what my exercise is going to look like for the next year, because I'll be doing the treatment every 3 weeks for the remainder of the year. I don't know if there's a question in there or not, but like what you could recommend, or like, I mean, because that's the part I'm most concerned about is the movement after my surgery. And then, you know, throughout my treatment, I've already made my appointments with my physical therapist. So I've got those on the books already, like 2 weeks out after surgery.
Good. And a PT will give you good guidelines as far as getting back into your specific training. I know for me, I do Olympic weightlifting. I actually competed in it before I got cancer. And then that's definitely been a challenge post mastectomy and recon because of all the alterations in, you know, the pectoral muscles. I've done 2 recons, first under the muscle, and then I didn't like it, the tightness. So I did over the muscle in 2019. So there's obviously, depending on your surgeries, you're going to have that, your plastic surgeon, or, you know, depending on what you're having done, they're going to have their own recommendations on as far as rest time, healing, recovery. And then they should be able to let you know when they give you thumbs up for that. And then you can start easing back into training. I know for me, like recovering from mastectomy, walking, I was able to start that within 2 weeks. Usually within 2 weeks of a surgery, you can start walking, and then build from there. And because you're already physically active, you're going to bounce back quicker than someone that has not run before. So just listen to your body. That's my number one. I don't like anyone to tell me like hard and fast what I can or can't.
Right.
You know, if I want to do something, I'm going to go on feel, and just if your body shouts at you when you start back, you know, to ease back a little bit. But you know, physical therapy, I'm glad you're getting in right away, because they'll be able to help you in that regard. Most surgeries, the wait time is going to be 6 weeks. But after a mastectomy, if you don't have implants in that they want to like heal and not have them move, you're going to be able to probably start back with some things within 2 weeks. Especially just doing those range of motion and light and stretching exercises, walking, things like that. Yeah. I know when I started running again after having my surgeries, it felt really weird. Like it was a lot of pressure on your chest. So
Yeah,
that took some time to, you know,
get used to
that. Yeah.
Okay.
I'm here to talk about exercise benefits for breast cancer patients and survivors. So I created a little slideshow to go through that with you and just give you some tips, and also talk about current recommendations and advice going through breast cancer and treatment, and ways that you can complement that with exercise and different providers to help you on your journey. About me, my name's Amy. I'm a certified cancer exercise specialist. I'm also a breast cancer survivor. I'm a food blogger, wife, and mom. My favorite things are time with family, which includes all of my animals. We have 3 fur babies, a dog Brownie, who's a GSP, he's 11, who actually is going through cancer treatment for hemangiosarcoma, but I joke, he's my 3rd child. And I have been in Charlotte for going on 4 years. So we moved here in 2018 and we love the area. So that's a little background on me. As far as exercise benefits, I mean, I think we all know exercise is incredible for our body. Movement is medicine and it's free. I've highlighted a few benefits of exercise for breast cancer patients and survivors specifically. There's so many benefits that we can gain from making sure that we stay active through treatment and recovery. And for survivorship, it's incredibly important. So first of all, mental health. As we all know, being diagnosed with breast cancer usually knocks the wind out of you. It's very unexpected. A lot of us deal with depression, anxiety throughout treatment, and even there's a certain level of PTSD after treatment with breast cancer. So exercise can help with that. Doing the right dose of exercise can actually even help with those endorphins, which is that chemical your brain releases that can boost your mood. So it's huge for mental health. That's one thing that's really important. Energy, obviously the right dose. High intensity exercise is probably not the best idea going through treatment. It's really as far as exercise dose, it's going to be dependent on the patient, but the right dose can help reduce fatigue both during and after treatment. Bone health, strengthening muscles also strengthens your bones. It will improve your bone mineral density to reduce the risk of osteoporosis. A lot of the adjunct therapies and treatments for breast cancer can increase your risk of osteoporosis. So exercise and strength training specifically can have a huge benefit on reducing your risk of osteoporosis by strengthening your bones. And also lymphedema. If you've had nodes removed, you can be at risk for lymphedema. Exercise can also help you manage that and improve the symptoms. This is pretty interesting. A large randomized controlled trial tested weightlifting and breast cancer survivors with lymphedema. The exercise group experienced less lymphedema flares or exacerbations, while the control group participants required more intervention. So they actually used to recommend women not lift anything heavy if they had lymphedema. Not only is it okay to lift weights, but it has actually been shown in tests to be very beneficial for lymphedema management as part of your care program. So that's one really, really interesting thing. I hope women realize the importance of that. Is strength training can actually help that. Types of exercise. Number one rule is before you begin any exercise program, make sure that you have clearance from your doctor. You want to work your exercise routine should be approved by your physician. Make sure you're cleared by your surgical team and oncologist before you start any new exercise. Types of exercise: aerobic, that's your walking, running. Anything that basically moves your body is going to be considered aerobic exercise. Resistance exercise. Strength training involves adding resistance to movement. This can be done with a variety of tools. You've got bands, free weights, machines, and you can even use your own body weight for resistance training. Flexibility exercise. You've got yoga, tai chi, stretching, foam rolling. Any type of myofascial release is excellent. That's going to all be grouped in with flexibility. And restorative meditation. I add restorative because I think meditation and deep breathing techniques can be very helpful for breast cancer recovery and overall health. When it comes to exercise, do something you enjoy. This is so huge. Is when people ask, what should I do, with breast cancer? I'm in treatment or after. I say, do something you love to do, just whatever moves your body. That's very, very important because you're going to want to stick with it. It's going to fill your cup, make you happy. If you love to hike, you're going to want to, do hiking. I actually walk my dog twice a day as my primary form of cardio. So whatever you enjoy, that's what I encourage you to do as far as exercising. Your care team. I'm often surprised at how many people are not referred to a physical therapist following breast cancer treatment. They can be so helpful in improving your recovery, helping you regain that range of motion. Strengthening. It's just so important. I was diagnosed in 2016 and I was lucky. I actually had a double mastectomy followed by reconstruction. I had immediate implant reconstruction, and then I later had it swapped out for regular implants. But my plastic surgeon referred me. It was 2 weeks out from my mastectomy. I was seeing a lymphedema PT just to follow up and work on some range of motion. That was not common when I was diagnosed back in 2016. There weren't a lot of plastic surgeons or surgical oncologists referring their patients to physical therapy. So I think it's gotten better. I think with social media and just having online resources, we know a lot more now. I think more people are being referred to PT, but I think it's so huge. If you can get in with a physical therapist, it's never too late. If you feel like you're a few years out and you're having some issues with pain or range of motion, don't feel like it's too late to see a physical therapist. They can help you with scar tissue or any other issues you might have that arise as part of your treatment. One thing I actually didn't realize initially when I had my surgery is just how instrumental a physiatrist could be. I really wasn't familiar with physiatry, but physical therapy can do your rehab. And if you need pain management along with that rehab, a physiatrist is an excellent choice. They're actually MDs trained in both physical medicine and pain management. So they can really be a vital part of your rehab program. Massage therapy is excellent. If you're in the Charlotte area, I have a great massage therapist. He actually does neural manipulation, and he knows a lot of techniques that help breast cancer survivors. He can really help with scar tissue, just healing in general. So they can help move the lymph with lymphatic massage, and just relaxation, reduce anxiety. Massage therapists are a wonderful tool in your care team. Oncology dietitian, like Crystal, we're going to hear from her today. I'm so excited to hear what she has to share, but they specialize in helping patients and caregivers get the right nutrition advice. Unfortunately, online, you hear a lot of wrong advice. I'm sure she'll have plenty to say about that, but there's just a lot of information out there. Sometimes it's hard to just weed through all of it. But an oncology dietitian is going to be your go-to resource for cancer nutrition. A psychiatrist and therapist, I think they're also a very, very important part of a care team for cancer. I know mental health it's a struggle after cancer. I mean, personally, I have had enough issues with that, just dealing with the anxiety of cancer, the anxiety of cancer recurrence, is it going to come back? Just dealing with the trauma of cancer. So a therapist can be such an important part, because we know that our mental health is going to also affect our physical health. So they're another great person to look to in your treatment. And a cancer exercise specialist. I think more and more people are getting certified in cancer exercise. When I did my certifications, I have a general NASM CPT certification. And then when I got diagnosed, I decided I wanted to add some cancer specific certifications with that, just to help people going through the whole process. So I have a couple of general cancer certifications, and I also did a certification in the Pink Ribbon program, which is specific to breast cancer. It is a breast cancer rehab program that helps women recover from breast cancer treatment and surgery. So I'll tell you a little bit about that in the end too. I have some resources for you. Current exercise recommendations. My overall recommendation is just keep moving. Of course, it's going to depend on how active you were going into cancer treatment, your fitness level. But don't think that it's too late to start. A little exercise is better than no exercise. And if you are concerned about doing the right exercise and the right dose, getting an assessment from a PT or, a trainer is super helpful in making sure that you're challenging your body in the right way without overdoing it. So that's always a good thing to do, is to seek out professional help if you are concerned about form or, doing the right amount of exercise. Overall, this is from the American Cancer Society, the recommendations for aerobic exercise: at least 30 minutes of moderate to vigorous intensity exercise 5 or more days a week. The ACS recommends 45 to 60 minutes 5 times a week for cancer prevention. But moderate exercise is walking. It's as simple as walking. And you can break that up throughout the day. So don't think you have to walk for an hour. If you want to take a 15-minute walk 3 times a day, that's also excellent. And you can break it up there. So I suggest always start with short sessions of 10 to 15 minutes, 3 to 5 days a week, and you can build from there. Everyone's going to be different in what their tolerance is. So you can always build on that. For resistance exercise, Strength training is recommended 2 to 3 times a week with 8 to 10 strength exercises with a range of 8 to 12 reps each. Just an overall general recommendation, not set in stone. Like I said before, it's going to depend on the client, but it's important combining aerobic and resistance exercise for healthy aging. They worked beautifully together. So I think strength and cardio is crucial. And this is something I hope we all can think about. Be as active as your body allows you to be. So whatever you can do, the right dose is energizing and actually can help with treatment tolerance. So going through chemo, radiation, I've had clients in radiation and they just feel so much better when they get done working out. The right dose and not overdoing it, nothing too high intensity, can be very energizing as you're going through those rough treatments. And that's it. I mean, that's a very brief summary of cancer exercise. I didn't want to take up too much time because I know Crystal's going to talk, but of course we can open it up for dialogue and questions at the end. But if you ever want to reach out to me, if you have specific questions that we don't cover today, you can always send me an email, and I've put that here. It's amycooks@gmail.com. And then my blog, if you need some recipes. So actually the food blog, I do a lot of healthy, high protein type recipes. So you can always check that out if you want recipes. And then Instagram, I'm at Amy Savory Dish. So thank you so much.